Hi, my name is Karen. I'm a certified integral yoga instructor and massage therapist at Way Wellness Center. This video will be covering the practice of Dirga Swasam, the deep three-part breath in yoga practice. You'll find that this is a foundational breath for many of the other Pranayama practices, and also a practice that you can maintain throughout your day without much effort once you learn how to do this. And eventually over time this will become your normal breathing practice as you become more used to it and find that benefits are so overwhelmingly beneficial for you. So what are the benefits of this practice? What is this practice? How do we do this practice? So that's what we'll be covering here in this video today. Dirga Swasam, the three-part breath in yoga, is an abdominal breathing. So when we are born, we do this naturally. Babies do this naturally, but some reason over time we start to forget how to do this. It's diaphragmatic breathing. The belly expands rather than the chest expanding. So the breath is coming from the base of the lungs rather than from beneath the collarbones. The benefit of this practice is that we take in more oxygen. It's much more calming. When we breathe diaphragmatically, it activates more of our parasympathetic nervous system. And when we're breathing from our chest and using the intercostal muscles, those are the muscles between the ribs, to do most of the breathing, it's actually more of a sympathetic nervous system response. It's anxiety producing. If you ever have experienced any type of anxiety or stress, you'll know that this breathing motion from the chest starts to actually snowball affect the anxiety that you might be feeling rather than alleviating it. So this breath will actually help to alleviate some of that stress. It will help to alleviate anxiety. It will help to strengthen your ability to breathe deeply and take in more oxygen. It will help to improve your digestion. Those of you that are familiar with the Chinese medicine practices and the six directional breath of Qigong, it's the same breath, it's just named differently in a different practice. When you are practicing this breath, you will notice that at first it may take some effort for you, especially if you're a chest breather. What is a chest breather? Someone who breathes with the chest, with the accessory muscles, with the shoulders, with the neck. So you'll be reteaching yourself how to breathe. But how often should you do this practice? I highly recommend doing this in the morning after you've woken up and taken some time before you have your coffee to start your day with a way to reprogram your breathing and really set yourself up for much deeper breaths throughout the day. It's also a helpful practice at night to sit before bed and to do this for several minutes. So I'll demonstrate this for you and then you can join in with me. Placing one hand above the heart on the chest and one hand on the belly. We'll scoot back just a little bit more. Breathing out completely. When you inhale through the nose, you'll feel the belly expanding first, and then the chest will start to lift. And then over time, you may be able to take a breath that is deep enough that the collarbones will rise. And then you'll exhale as the chest falls and then the belly contracts in. So I'll do that now, actively breathing, so that you can see how this actually looks. Now joining with me, one hand on the chest, one hand on the belly, sitting up straight and comfortably. You can sit on the edge of a bed, or you can sit on the edge of a chair. We'll be doing this for several rounds, and I will instruct you at first, and then I will instruct you less over time to give you some space to allow you to process this for yourself. All right, now ready? Hand on chest and hand on belly. Exhaling completely. And imagining there's a balloon inside of the body and you're blowing up the balloon from the bottom to the top. Expand that balloon out into the belly. Belly expanding, chest lifting, feeling the breath moving in all directions. And then you exhale, the chest falls and the belly contracts. Inhale as the belly and the back expand, the chest expands, the rib cage expands as the chest lifts. Exhale as the chest falls and the belly contracts. Inhale, belly expands, chest lifts, collarbones may rise. And now dropping the chest and contracting the belly. Inhale deeply, belly expands, chest is lifting and rising and falling, the belly contracts. Deep inhalation into your three-dimensional body, feeling the air going in all directions as the chest lifts. And now you exhale as the belly and the chest fall. Belly expands, chest lifts. Chest falls and belly contracts. Deep breath in, belly expands. Chest lifts. And exhale, chest falls and belly contracts. Inhale, belly. Chest. Exhale, chest and belly. Inhale, belly, then chest. Exhale, chest, then belly. Belly and chest. Exhale, chest, belly. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale completely. Relax the hands back down. Return to your natural breathing pattern. Noticing how you feel. If your eyes are not closed, you may close them now. Tuning into your body. Noticing any changes in the way your body might feel. Noticing any changes in the way your breath is already moving. Noticing any changes in the way your mind is active or inactive right now. Opening the eyes. So you may notice that your mind is more quiet now. That is one of the amazing effects of this breath, as well as the calming nature, the improvement in digestion, the release of stress, just the overall relaxation that is associated with this deep breathing practice. So as we wrap up, I recommend, again, doing this for several minutes in the morning, taking time for yourself, 3 to 5 minutes in the morning, 3 to 5 minutes at night before bed, or at least in the evening, preferably without having eaten first or several hours after your last meal. I recommend practicing this several times before moving on to the next pranayama videos in our series. The next recommended video would be either Kapalabhati or Nadi Sudhi. To learn more about this, please reach out to us, schedule a telehealth consultation to learn what practices are best and healthiest for you and how to go about adding these into your daily routine. Or send us an email at waywellnesscenter@gmail.com. Our phone number is 412-772-1461. Thank you, and Om Shanti.